Thank you. And just as a reminder, today is your benefit fair. So we do have Blue Cross Blue Shield representative here over in the other building. And we also have Delta Dental here, Aflac is here, both of the air ambulance companies are here, and then we have information on your VSP and your credential. So
How are they leaving today?
4. So keep that in mind. We did want to make sure in particular that Blue Cross was actually on site this year because we made this change mid-year. So if you do have in particular questions or questions comparing the plans, then she will be more than happy to sit down and talk to you one-on-one as well. So with that, we put this presentation together based on questions that have come in since July 1st, since we implemented the high deductible health plan. So if you have additional questions or anything else that's come up, please ask them. If they're more personal or more geared toward your situation, you might want to wait until afterwards because we all sit in meetings all the time and sometimes your coworkers don't really care what's going on in your life. So, but I'm more than happy to answer those questions.
And also, while I'm thinking about it, knowledge base, please use knowledge base. There is a lot of information about the HSA and high deductible health plan programs right there on knowledge base, including how does one of these plans work, handbook and stuff like that. So a lot of information on knowledge base if you would just kind of take the time to pull it up and use it also. Okay?
All right, so with the high deductible health plan, there are actually 2 pieces to it. So there's the high deductible health plan, which is the insurance part. And then there is the HSA, which is the health savings account. So they are 2 separate things. You don't necessarily have to have one to have the other, but you do have to have a qualified medical plan to have an HSA. So you can't have an HSA with either of the other 2 plans that the college offers, but you can have one with the high deductible health plan. So a high deductible health plan, typically there's no first dollar coverage, which means that you don't just have copays when you go to the doctor or you go to pick up prescriptions. You are responsible for all costs until the deductible is met and you reach 100% coverage. Now, with that being said, you still get the discounting through the carrier, which is Blue Cross Blue Shield. So in my particular case, I go to Mount Graham Family Practice. They bill a regular office visit at about $140 to Blue Cross, and my part that I pay once it's discounted is $70.09. So it is a pretty substantial discount through Blue Cross Blue Shield, but I don't want that to scare anyone off that you're gonna have to pay full price for every single thing that you do until you reach that deductible. The health savings account part is actually IRS governed and can only be used for specifically qualified health expenses such as doctor's visits, ER, surgery, prescriptions. You can use the funds in your HSA for dental and vision expenses, but it does have to be a qualified medical expense. If you decide that you just want to go on vacation with your health savings account, you're more than welcome to do it because it's your money, but you will pay 20% tax on that at the end of the year. Okay. So there are limits on what the minimum deductible can be on a high deductible health plan, and there's limits on what the maximum out-of-pocket can be on a high deductible health plan. And those again are set by Health and Human Services and the IRS. So for 2020, on a single plan, the minimum deductible has to be at least $1,400. The family deductible has to be at least $2,800. And the maximum out-of-pocket expense that you can be responsible for in 1 year on a high deductible health plan is $6,900 if you're covering just yourself, or $13,800 if you're covering family. And family for these particular definitions is more than just you, whether it's a spouse or your entire family. That's family coverage, you plus anybody else.
What does
Yes.
the minimum mean? Go ahead. What does actual minimum mean?
It means that if EAC wanted to come in and offer a high deductible health plan, but because your deductibles in previous years have only been a maximum of $350, so they think a high deductible to employees here is $1,000. But they wouldn't be able to do that and still have an HSA because the IRS says that the minimum deductible has to be at least $1,400 to qualify for a health savings account. Yes, sir.
So what is the EA plan?
3,500.
100%
Per family?
per person,
Person.
or 7,000 per family. So again, one or more, 7,000 per family. However, the way your plan is set up if one person in your family meets that $3,500 deductible, they have 100% coverage from that point going forward, and the rest of your family has to meet the other 3,500. Okay.
So that's the very maximum that would be paid in 1 year, would be the 3,500.
Unless you meet a very specific set of circumstances and services like bariatric surgery. There's 3 or 4 different services that if you seek those services or have those procedures, you could have a little bit more out of pocket because they're not typically covered on a health plan.
So for our first year, is that 3,500 gonna be the cap as well? Or like we paid in before?
To contribute to your
July 1st?
HSA.
No,
For the deductible.
for the deductible. So like
So anything
with
you would,
co-pays and everything on the old plan?
so anything that you have paid, now I want to be very specific about this because it can get confusing because your one plan does not have a deductible. So there's no deductible carryover. However, any co-pays that you paid on that plan goes towards that out-of-pocket maximum on your plan, which is also $3,500 for most things.
So do you know when they're gonna get those showing yet?
They should be showing. Last I heard, they were showing.
Were you on the buy-up plan, Doreen?
The buy-up.
The zero
I went from
deductible,
the basic to the HSA.
the base plan.
The base plan? Those should have all transferred over. Have you gone into your My Blue?
They still weren't on there, and I had a
Okay.
doctor that looked like 10 days ago, and he said it was still only showing the deductible part, the 350 deductible part transferred over, but that's still all that is showing.
Okay, so do me a favor, and if you can, stop by today over there
Okay.
and either talk to myself or more particularly talk to Tracy with Blue Cross Blue Shield, and she can look it up for you. But I know that it took a little bit because we had to wait for the year end, the plan fiscal year end to end, and then to have to move everything over. So they
Yeah,
didn't
the
actually
last
show.
time I talked to you, that's what it was. That's kind of why I came today, was to see if you had any more information. on
Yeah,
that.
so to our knowledge, the last we checked, they were all showing.
Yes.
So again, if yours are not, then definitely let us know and we'll.
You'll want to go talk to the Blue Cross Blue Shield rep. Okay, sorry about that digression, guys.
Now getting back to this, the only caveat to first dollar coverage is preventative care. All of your preventative services are still covered at zero money out of your pocket. You're not subject to deductible. So that is your annual physical, your annual blood work, well woman exams, mammograms, colonoscopies over the age of 50, prostate exams for men. There's a whole long laundry list of preventative care. If you're going to your doctor just for those preventative services, it shouldn't cost you anything.
That's key.
You can't.
That is the only thing
Yeah.
you're doing on that visit.
If you go in and you start talking to your doctor and saying, oh, my knee's been
Oh,
hurting,
yeah, I get that.
or my elbow's been hurting, then it's diagnostic and it's not preventative anymore, and you're going to pay for that visit. So if you're there just for your preventative visit, that's really all you're there for.
It shouldn't be any cost to you, but again, as the consumer, you've got to play by the rules too. If you're going in for preventative care service, that is all you are doing. Don't try and game the system because the doctor's office and Blue Cross Blue Shield will ask you to pay for that. Okay?
As soon as they put a diagnostic code on anything, it's not preventative anymore, is really the key to it. So especially, it happens most specifically when you're going for your annual blood work, because if you're really just going for your annual blood panel to see where all your levels are, but you start talking about other things, then they're going to put a diagnosis on that blood work looking for something, and then you're going to get a bill for that blood work, whereas it should be free preventative. Okay. So because health savings accounts are governed by the IRS, they also set the contribution limits and how much you can put into those accounts every year. So for 2020, those federal contribution limits are $3,550 for an individual or $7,100 for a family. Now, what you will notice is that you can actually contribute a little bit more next year than what your deductible and out-of-pocket max actually is on your plan. So you could actually continue growing that HSA even faster if you were to contribute to the maximum. Now you can contribute that maximum amount regardless of what the deductible is on that high deductible health plan. So if you did have a high deductible health plan like me that has a $6,750 deductible, you still could only contribute the maximum of $3,550. Or on the flip side of that, if you had a high deductible health plan with a $2,800 deductible, you still could contribute the $3,550 as an individual.
I could just note, okay, now remember that the contributions into that HSA account are tax-free. That's one of the reasons why we want to do this. We're saving some money on taxes right off the bat by saving for our financial well-being in the future. So remember that. And we expect that the ability to contribute a certain amount of money as governed by the IRS will continue to increase each year. So far, they've increased it $50 every year since.
It generally goes up $50 a year on an individual plan, $100 a year on a family is where it typically goes with the IRS. Contributions can be made either by yourself, by your employer, or by both of you in a combination, but it still cannot exceed those contribution limits. So in your case here at EAC, they are contributing $190 a month towards your health savings account if you elect that. So if you're going to contribute on top of that, you need to do the math and figure out how much they're contributing for the year and how much you can contribute.
And we have a form that does the math for you, okay? Anybody who signs up for the HDHP with the HSA, we do have a form that for health equity that literally steps it out. And those of you who are already doing the HDHP have seen this form. It says, okay, in this year we can contribute this much. That 190 that the college is automatically contributing from your flex dollars is already on the form, and we say, okay, that means you can contribute up to this much more in the year. That means this much per paycheck, and then you all would decide how much more you want to contribute in. The math's all done right there on the form, and that form is on knowledge base. And I will also be contacting everybody who is on the HDHP HSA program personally at the end of the month to make sure that we sign new forms for the next annual contribution year, 2020. Okay, so there's a form, the math is done for you, and that's your opportunity to save on a tax-free basis. And the college is basically just helping y'all out by making that $190 a month automatic, but you certainly want to consider the very real need and opportunity to contribute more to reach the maximums. Okay.
And just along those same lines, you can also change your contribution amount at any time. You don't have to wait till open enrollment. Now, I don't know that your fiscal office necessarily wants you going in every other paycheck and changing how much you're contributing, but you can change your contribution at any time. Penalties can apply to funds in your HSA if you stop participating in a qualified high deductible health plan. So if you're on a high deductible health plan right now, you came on in July and you're like, you know, this isn't working for me, I'm going back to the base plan or I'm going back to the buy-up. You can do that, you just cannot contribute to your HSA any further. You can continue to use the funds out of your HSA until they're exhausted, but you can't contribute anymore. And
you have to have those two parts.
Right.
The high deductible, yeah.
There is a one-time rollover allowed from a healthcare HRA or IRA into your HSA. So if you have one of those accounts currently, you want to roll those funds into your HSA, you can do that on a one-time basis. Again, defined by the IRS, anything more than employee only, not including domestic partnerships unless they're allowed by your plan, is family coverage. If you are 55 and over, the IRS says, okay, because this is a savings vehicle, you can actually do a catch-up contribution once a year of an additional $1,000 into your HSA. So that $3,550 for 2020 that you're allowed, if you're over 55, you can actually contribute an additional $1,000 to help that grow a little further.
And for anybody that might apply, it is actually very easy to do. You'll have your HSA health equity account set up right there on their webpage. When you sign in or whatever, it says additional contributions. How do you do this? You click on it, it says we can do it one of 3 ways and go to it. It's really very easy to make additional contributions.
And just see, yes.
And that's still tax free.
Yes.
Yes.
At the end of the year, when you do your taxes, there is a question on the tax form. Have you contributed to an HSA this year? And you say yes, and then you tell them how much you contributed post-tax, and you'll get those tax benefits when you file your taxes at the end of the
So
year.
have you contributed individually?
Yes.
All right, because everything that we're contributing through payroll deduction
Is already
is
pre-tax.
already tax-free. And I believe the health equity statements will very clearly set that out. You know, this much came in through payroll deduction. This much was an outside contribution. And so you and your tax preparer will know exactly which amounts to put in what box. Okay,
If you and your spouse are both covered by a high deductible health plan and you're both over the age of 55, you can both do a catch-up contribution once a year. However, you have to have separate HSA accounts to do that. So you would have to have your own as an individual. They would have to have their own as an individual. And you can make those additional $1,000 catch-up contributions. And they have to be made by you, not your employer can't do a catch-up contribution for you. Does that make sense? Kind of, sort of? It's the IRS, so, you know, there's always
Yeah.
gray areas.
yeah, all of this is governed by IRS, so be very careful.
Yeah, the family plan did not do the $2,000.
Right. If I do have several employees that their spouses have an HSA with their employer, and so they carry separate
You can,
plans.
yes, if your spouse is covered elsewhere by a high deductible health plan, the only thing to remember on this rule is that if one of you is covering children still and one of you just has single coverage, you can have one HSA account that contributes the family maximum, or you can have two HSA accounts that have single maximums, but you can't do, they're covering the kids, so we're gonna do the family maximum over here, and I'm just covering myself, so I'm gonna do the single maximum here. That gives you over $10,000 in your combined HSA accounts, and presumably you're filing a joint tax return, and the IRS then will go, nope, sorry, you're gonna get taxed on those additional funds. Does that make sense? Yes.
So he and I are married, and I don't have another insurance. I
We're
can't,
both old.
and we're both over 55, or 55 no. Anyway, so we can't each just contribute 1,000. It's
Unless
just the one.
you were to go out and get your own health savings account and he has his own health savings account here, then you can put in, but you can't, unless you're covering children.
They're all
We're
gone.
not, they're
Yeah.
gone, they're
So-
sold.
Yeah, so you could have separate HSAs.
Would she have to have separate HDHP?
No, because you're covered by him here,
Here you go.
right? So no, you wouldn't have to have a separate HDHP, but you would have to have separate HSAs.
Interesting.
So you can do the maximum for individual over here with your $1,000 catch-up contribution, and you can do your individual maximum over here with the catch-up contribution, because you're still not going over that family contribution limit together on your taxes. Does that make sense?
Not
Sorta.
clear still. I could do it through the college, still do that, no,
No, you would have to go get your own separate
okay.
HSA, and you can do that through Health Equity, actually.
Yes, I was just gonna mention, they make it really easy to set up more savings accounts.
Yeah, so you would just have it separately and pay your own fee separately, and then you would have to do your own
We wanna
contributions
talk
on your
about
own.
that a little bit more, because I think.
That's a separate.
Yeah.
It would be separate. She would need to, since she can't do a HSA through the college because she's not an employee, correct? Is that what I'm getting here?
Right.
So she would have to go out and get her own HSA. Now, there are tons of vendors out there to open HSAs with. Health Equity is the vendor we use here. They will allow individual HSAs. So she could go to Health Equity directly and say, okay, look, my husband works at the college. He's got this. We're both over 55. We want to take advantage of the catch-up contribution. I need to open my own. And they would open her own for her.
But you wouldn't be able to do it as a family plan one, like you were saying earlier. You'd have to do it separate individuals, 3,500.
Yes.
Right, because again, the insurance, the HDHP insurance is one set of insurance. So you can only go to the maximum for one insurance program. And so even if they split the HSAs up, at the end of the year, when they file their taxes, the IRS does not want to see more than $7,100
$100.
contributed in 2020.
They're gonna look at it as individually separate.
Right. But
Yes,
because you have to
but
account
in
for them
total,
on your.
because you file family taxes, and the HDHP was the family coverage. So there's a lot of little caveats.
And again, talk to your tax professional, because I am not.
Please.
I can talk to you all day long about insurance and I can explain this, but I am not a tax professional and I don't want the repercussions of tax penalties coming back to me. But I can explain how it works, but I would definitely recommend talking to a tax professional.
But if you're playing catch up, you still can only catch up to the point of it being $7,100.
No.
No, you can still do an additional 1,000. So you'll be able to go to 8,100 if you've got family. So these are some of the questions that came up about how you can use your HSA funds once they're in your account. So the first and most obvious is tax-free distributions for qualified medical expenses for yourself, spouse, dependent. including medical, prescription, dental, vision, and limited over-the-counter products. And for those over-the-counter products, you do have to have a written prescription still from the doctor saying that you need it. You can get a full listing of what is a qualified medical expense on the IRS website at irs.gov. You can only use them for qualified medical expenses incurred on or after the date that your participation in the HSA and high deductible health plan began. So in this particular case, if you came on July 1, you cannot pay bills from May. You can pay anything from July 1 forward. If you decide, if you have an emergency, or you just decide one day that, you know, I'm just stressed out, I need to take a vacation, and you take the money out of your HSA for another reason, you are more than welcome to do that again because it's your money. However, you will pay a 20% tax penalty at the end of the year for using it for something besides a qualified medical expense.
Unless you reimburse.
Unless you reimburse yourself prior to tax filing deadline of April 15th. If you put the money back before April 15th, there's no penalty. But if you need a new roof all of a sudden because of a catastrophe or something happens and you absolutely have to pull the money out, just be aware that you're going to pay a penalty on it at the end of the year. You can use your funds to pay expenses from prior year as long as the high deductible health plan was in effect at that time. So next year, if all of a sudden you get a bill from Mount Graham Hospital from this year and you were already on the high deductible health plan, you can use your funds to pay that, but you can't use it for anything before July 1st. Again, distributions made in error can be returned to your HSA by tax filing deadline and there's no penalty. And you should always keep all receipts just for substantiation in case the IRS ever comes back and asks for it. Because again, it is an IRS governed account. And if they ever just want to check and make sure that you're using it for appropriate things, most of the time it's going to be coded by whoever runs it. But say you're at a Walgreens and you just run your card for a qualified medical expense, but it's still going to just show Walgreens. Just make sure you keep all of your receipts in a file somewhere. So if the IRS ever does ask you, you have that information.
So the card will work kind of anywhere?
debit card.
It won't necessarily work anywhere, but I can tell you that it will work anywhere that is deemed a pharmacy. So you could literally walk into Walgreens because they are a pharmacy and you could use it for just about anything and it'll go through.
Yes.
At Walmart, you actually have to be at the pharmacy and it would run. If you try to use it at a regular register, it will stop you.
Watch out for you.
Health equity, yes ma'am.
It says dental, what about orthodontics?
Yes, you can use HSA. Qualified medical expenses is any dental and vision expense. Just be aware that anytime you use the funds out of your HSA for that, you're not helping satisfy your deductible on your medical. But if you do want to use it for orthodontics, or I have people who use their HSA funds for LASIK because it's not covered by your vision insurance or medical insurance, but it is a qualified medical expense, you can use your HSA funds for that. If you actually go to irs.gov and look at the qualified medical expenses, there are things on there that you would be surprised. There's things like to modify your home after an accident. You can use your HSA to help. Yeah. Yes, sir.
What did you say about that it doesn't go towards your deductible?
Just remember, if it's not a medical expense and it's not being billed through Blue Cross Blue Shield, they don't know. And so how are they going to apply that towards your $3,500 deductible so that you can get 100% coverage?
But you can use your fund because they're separate. Again, remember they're two separate things, high deductible health plan and HSA. The health savings account, the way the IRS governs it, it can be used for any qualified medical expense, which includes dental and vision. So you can absolutely use it for glasses or contacts or LASIK or orthodontia or whatever you want. Just be aware that if you're depleting the funds in your HSA, it's not necessarily giving you credit towards your deductible on your medical plan because those expenses don't go through your medical plan.
Right. But if we use it at a doctor, it's still gonna.
Right. If you use it as doctor, it's still gonna. Then the claim presumably goes to Blue Cross first anyway, so they're going to keep account of that for you. If you guys have a high deductible health plan, I highly recommend downloading the AZ Blue app and having it on your phone because you can actually track all of your EOBs and all of your expenses and everything right there and see where you are in your deductible and out-of-pocket max in real time.
Very easy.
So here are the questions that have come up from other employees in the college since July 1st. How do I know what a service is going to cost? If you are registered at azblue.com, they do have a cost estimator in there. that uses real claims data in real time on your claims. So say you need to go have an MRI of your knee, you can go in and put MRI of the knee and tell them where you're looking, whether it's Tucson or here or Sierra Vista or Phoenix, and it will give you all of the providers that can do that service for you, and it'll give you what your out-of-pocket cost is going to be within 2%. Now, I had to use the cost estimator this year. My husband needed a CAT scan. We have a high deductible health plan. If we did it at the hospital, it was going to cost around $3,000. We found a place in Phoenix that he was able to get it for $150. So there is a huge differential in costs when you're talking about procedures and processes. So they have over 16,000 procedures in that cost estimator. So if you know you have something coming up, I would use that cost estimator. Other than that, you can also call Blue Cross Blue Shield. They can typically pull up the service and tell you close to what it'll cost you. But just be aware that you always get the Blue Cross Blue Shield discounting before you're responsible for anything.
And I'm just gonna throw in here, I'm sorry, I
No,
know
it's
I'm
fine.
very annoying, but, okay, so if you're on an HDHP and you're using your HSA and stuff, it's been my experience and the experience of most of the people using this program that when you go into a doctor's office for a medical something and you hand them that card, they know automatically at this point in time, we've been doing this for 10 years, at least through the industry, they know that they're not going to ask you for any money right then because none of you know exactly how much that bill is going to be. And so the minute you say, I have a high deductible plan, that billing clerk person type thing should know, oh, okay, well, thank you. We're just going to run this through the insurance and they're going to let the insurance determine, you know, and again, that's how they can do these estimators because it's the insurance and that contracted price that's going to drive what you're billed for that service. So in one sense, it's kind of nice. You go in and get your services. If you've done your homework, you have an idea what it's going to cost, but you wait until that facility or that doctor bills you when it's run through the Blue Cross Blue Shield before you ever have to plunk any money down.
And I also will say that there are some providers that are going to tell you, no, you need to pay me up front. At that point, I would offer them, yeah, I would offer them a small amount of money and say, here, I'll give you this, and then we'll wait for it to go through my insurance. Don't ever let a billing person bully you because sometimes they do. They will try to. I know Mount Graham Family Practice does not require money up front. They will bill insurance and then give you a bill. I've heard differing stories from Healing Valley Clinic, from different clients of mine with different groups in a high deductible health plan. Just kind of be aware and don't let any billing person or front desk person at any provider ever bully you or in any hospital. So the next question that came up was, what if I don't have enough money in my health savings account to cover the cost of something? So say you had to have surgery, your gallbladder, and you hadn't built up your HSA yet, what happens then? You can use what funds are in your HSA to make a payment plan with the hospital or the provider. As the funds become available in your health savings account, you can reimburse yourself and continue to make those payments to the provider, or you can put the full balance on a credit card or pay cash and then reimburse yourself as those funds become available in your HSA. Because you can ask for the distribution to come back to you as a check or direct deposit into your bank account if you've already paid for them. So please don't be scared away by that. But on the flip side of that, if you are just electing the HSA high deductible health plan here at the college, they do front load your card for the first 6 months worth of contributions, which comes out to just under $1,200 right up front. So unless you do have a catastrophic event, that should get you through the first 6 months as you're also making contributions, and then the college will continue from there. How do you reimburse yourself if you pay cash? First of all, it does have to go through the insurance to be reimbursable expense for a doctor's visit. They want to know that it was run through Blue Cross and that it was discounted. So you would submit your receipt and explanation of benefits to the Health Equity website or app, and they will send you a check or direct deposit the funds back into your personal bank account. How can you make additional contributions to your HSA? Log into Health Equity. There's 3 or 4 different options. One is writing them a check. One is a wire transfer. One is, again, an IRA or an healthcare HRA rollover. Again, at the end of the year, you can claim those on your taxes. Can you change your contributions at any time? Yes. So if you elected to go ahead and max it out and now you're like, that's just a little too much for me, I need to lower that, you can do that. Or if you started with maybe $25 a paycheck, you're like, okay, I think I can afford to put a little bit more in, you can go and change that. Please don't make your fiscal office crazy, but
It's not the changing every paycheck, guys.
the contribution limits again for 2020 went up by $50 on the individual and $100 on family coverage. So it's $35.50 for single coverage and $7,100 for family coverage beginning January 1st. What happens when I turn 65? This is probably one of the biggest questions we've had. Can you have a high deductible health plan HSA if you're 65 or older? Yes and no. You can have a high deductible health plan, absolutely. You can have a high deductible health plan no matter what if you're still working. You cannot, however, contribute to an HSA once you are enrolled in Medicare. Now, with that also comes the freedom, though, that once you turn 65, you can use the funds in your HSA for anything with no tax penalties.
See, that's why we want to start it now. So we build up that savings. So when we get to 65, we've got that nest egg there to take care of
if you're going
whatever
to,
we need to do.
yeah, if you're going to continue working past 65 and have the benefits through the college and you want to continue contributing to your HSA, the only way to do that is to completely opt out of any Medicare, which is Part A, Part B, Part C, or Part D. You have to go to Social Security and say, I do not want. Part B, they're used to. Part A is a little bit different for them these days. You have to tell them, I do not want Part A. Because if you have any part of Medicare, you cannot contribute to an HSA. And there are tax penalties for continuing at that point. Yes, ma'am. Did you have a question?
Well, I was just gonna say, so that would mean you're taking part in the college insurance, right? If you're not gonna do Medicare? When you're
Right.
after 65?
Yes, if you're
Okay.
going to continue working past 65 and you want to, and again, at that point, you can choose to either stay on the high deductible health plan, opt out of all of Medicare and continue contributing to your HSA, or you can just change to one of the other plans the college offers and you can use the funds out of your HSA. So you just can't contribute any further. I know it's a lot. I know it's confusing. And trust me, it's because the government runs it, because the IRS is behind it all. Can you use your HSA for healthcare expenses for someone other than yourself if you are on single coverage? Yes, if they are a tax dependent. So if you only covered yourself here at the college and that's your contribution limit, but you've got a child that is still a tax dependent, you can use the funds to pay their expenses as long as you're still claiming them on taxes. Once you stop claiming them on taxes, you can't do that anymore.
And then just remember that, again, that's not satisfying your deductible.
Right. Where can you see your deductible and out-of-pocket amounts? azblue.com. Again, they've got a great app. It was kind of wonky for a few years. They've improved it dramatically over the last 6 to 8 months. It works a lot better. It's a lot more user-friendly. You can go in and see at a glance where you are in your out-of-pocket for the year, where you are with deductible. You can see all of your EOBs. You can elect to only receive electronic EOBs. I hate getting mail just because it just is paper that then I have to shred or file or do something with. So I've elected, they send me an email when I have an EOB, then I know I've got it. I go and I look and it's all there. Why can't you have an HSA if you're on another plan that doesn't qualify? Because the IRS says so. You have to have a qualified HDHP. So if you have dual coverage with your spouse and your spouse has a traditional copay plan, you cannot participate in this as long as you are still covered with them. Oop, need to go back. There is a guidebook for HSA, again, because it's governed by the IRS, it's 232 pages, but it is on your knowledge base.
It's there, people. You can read it.
So when you're really bored and have nothing else to do, feel free. If you currently are on the high deductible health plan HSA, you do need to fill out a new contribution form for 2020. They are available during open enrollment, November 1st through 30th. You'll need to see Laurie to do that or go on knowledge base and pull the form. Again, we're all on site today. They did all travel to come to answer your questions. So, and we have some really cool raffle prizes that we're giving away for no other reason that you show up is to sign up for the raffle. I'm good with that, but they did travel all this way. So, come and talk to them. They're happy to see you. If you decide to make changes during open enrollment, they go into effect January 1st. My only other caveat right now that I want to remind you is that if you came on the high deductible health plan in July and you are contributing the maximum this year of $3,500 for individual or $7,000 for family before December 31st, So you were the responsible consumer and said, okay, I'm gonna jump on board with this and I'm good and I'm gonna contribute the maximum this year. Yay for you, but you cannot change off of that plan until the end of next year. You have to stay on all the way through next year if you were contributing the maximum contribution before December 31st of this year. That is not the case if you're on for a full plan year. It's because it's a short plan year. Again, the IRS says if you contribute the maximum, you have to then stay on it for a whole other year. If you have additional questions, please let us know. That's why we're here. My office is in Safford. I was gone the last month on the road doing enrollment meetings, but I'm back now. I should be the rest of the year. Please note your specific circumstances. This is my disclaimer. Your specific circumstances and individual tax or benefit situation may require more in-depth conversation. We are not tax professionals. I am not, absolutely not a tax professional. Don't claim to be a tax professional. I can talk to you about insurance all day long, but I am not a tax professional. And also, remember if you do talk to Tracy with Blue Cross Blue Shield, she is with Blue Cross Blue Shield, not Health Equity. So she may not have the HSA answers right off the top of her head, but if she doesn't, we will definitely get them for you. Does anybody have questions? Yes, ma'am.
How is the HSA invested, and what are the investment fees for that? You get
You can find that right on Health Equity's general homepage. And there is a point after you get so
I
much
think
into your account or
$1,000.
whatever that you can start
Investing.
directing,
And
what
you-
you want your funds.
Yeah,
to do.
there's a few different options, and you as the consumer opt that. You just have to work with Health Equity directly.
And I forget what the savings rate is, but it's just like any other savings account.
It's not a huge amount,
It's your money, it's your savings account. It just has some funky rules because of the IRS, but
And it's
Yeah.
not use it or lose it, so it rolls over year over year.
it's yours.
It's your money. If you leave the
Tax-free.
college, it's your money. Even the money they put in, it's still your money. So, you have your choice of 3 plans. The base plan, they pay 100% of the premium for, and that's great. On this plan, they also pay 100% of the premium, plus you get extra money. I would take the free plan and the extra money every day.
I have a question. Say, for instance, one of us gets cancer,
Yes.
something huge. Would this plan be beneficial, or would it be better if we brought another plan?
Your out-of-pocket maximum on this plan, except for a very small list of covered services, is $3,500 as an individual. So if you get cancer, and we're talking a cancer diagnosis that could be in the hundreds of thousands of dollars, your responsibility at this point is $3,500.
Which
On your
is
other plans,
lower
on your
than
other
any
plans,
other plan.
on the base plan, your out-of-pocket maximum is $4,500, and on the Cadillac plan, which is the zero copay plan, your out-of-pocket maximum is $6,850. So really, people always look at the deductible. That's the first thing that every consumer goes to. The number you need to really pay attention to is your out-of-pocket maximum. What is my responsibility if the bottom falls out? What am I literally responsible for that's going to stop the bleeding and be my safety net? That is the better number to look at.
And what is that number for a family?
7,000. But again, if you get cancer, 3,500, you're at 100% coverage. The rest of your family has to do the rest of it. You don't have to satisfy.
Same network as what we're using.
Yes,
Yes.
same network. Blue Cross Blue Shield of Arizona.
What about
And Mayo. And,
Prescription coverage, you're going to pay for your prescriptions.
oh,
There's no
yes.
copay. However, two things on that. One, most generic prescriptions are under $10 with a high deductible health plan. So it's not going to be a financial detriment to most people. If you take a name brand drug or a specialty drug, there's 2 things on that. First, Blue Cross Blue Shield, when we implemented this, added in an expanded preventative prescription list with zero copay for people on the high deductible health plan only. That list is about 4 pages long and includes every diabetic drug, asthma drug, cholesterol drug, high blood pressure. There's a whole bunch of them, but that's on your knowledge base as well. So if you are diabetic, you take insulin, it's on that list. It's not going to cost you anything on a high deductible health plan. You would still have a copay on any of the other plans. If you take a specialty drug, and specialty drugs are drugs that are very, very, very expensive, typically injectables, you would know if you take one, they're going to be your Enbrels and Humiras and Prolia, things that cost upwards of $6,000 to $10,000 or more a month. If you have to pay for that drug, you would pay for it literally one time in the year, and then the rest of the year would be paid 100%.
So if that would go towards your deductible.
Yes. So I'll give you the example because I hit all three of those scenarios. Okay, on prescriptions, I take 3 different prescriptions. One of them is a generic. It costs me $5.72 when I refill it. Okay, one of them is a brand. There's no generic available, and it's a very expensive brand. Okay, I hit my deductible when I purchase that one prescription one time. And then I have a specialty. And the first thing I did when I got that list from Blue Cross Blue Shield that says, hey, here's some maintenance things, preventative, whatevers that we feel would be beneficial to add to the high deductible plan at no cost to the patient. I'm like, okay, I admit it. I was on Prolia for several years, and I go in and get my injection, and that was a specialty drug. But I looked at the Blue Cross Blue Shield retail price for Prolia, and we're talking, oh my gosh, several $1,000s for each injection, closer to that 6 and 7 that she's mentioning. Okay, but I happen to know that there are comparable drugs that do the same thing as Prolia that may be on that maintenance list, and by golly, there was. So I ran right into my doctor and say, okay, I can no longer afford to do the injections on this one, but this drug right here does the same thing. And it's on this maintenance list for $0. Doctor, can you change my prescription? And he did. So it works.
And typically, if you take one of those drugs, you are pretty well versed in the class of drug that it is. I take Victoza, which is a non-insulin injectable. I'm on a high deductible health plan because we are not a group of over 100. We do not have the extended preventative list, and it costs me about $600+ a month. So if I was on this plan, it wouldn't cost me anything because it is on your expanded preventative list.
Yes, it is.
So, know your medications. You can go right onto the AZ Blue website, go to their prescription tool, and you can price all your drugs out that way too.
I'll also give my plug for their mail order program. Okay, that Optimex in the mail order, you get 3 months for 2 months copays. So again, that particular, my middle tier drug there's no generic available, but it's brand and I've got to have it. Mail order, it only cost me a couple of $1,000 for 3 months worth of prescriptions. So I'm one of those people that say, oh, I'm going to hit my $3,500 deductible every single year, but I am going to be 100% covered from then on. And I've paid that $3,500 deductible with tax-free money that I have put into my HSA, saving for the future.
And
so
because they are pre-tax contributions, lowers your taxable income, pay fewer taxes. So even though the IRS governs all this, they get less of your money at the end of the year.
But you do have to follow their gosh darn rules, and it's a little scary at first. I'll admit it.
It's just a different way to look at healthcare. It's a different way. When these plans first came out, they were called consumer-driven health plans, and I think they should have left the name that way instead of changing it to high deductible health plan, because it really is you in the driver's seat. You are not going to go necessarily, not that there's anything wrong with our hospital, but you're not going to go to Mount Graham for a $3,000 MRI if you can take a day and go to Tucson and pay $450 somewhere else. When it's coming out of your pocket and the insurance isn't just paying anymore, you look a little deeper. And every time you save that money, you're also saving the college money, because this is a self-insured plan. So if they're not having to pay that $10,000 bill to the hospital, they're paying a $2,000 bill to the other radiology place. Then next year when we come back, we're not going to have to come back and say, yeah, we're going to have to increase rates, and they're not really able to pay 100% of the premium anymore. So now you're going to have to pay a little bit more. And so the more focused that you can be on protecting your health plan all the way around, the better off everybody will be.
Does the HSA thing have an app?
Health Equity does have an app, yes.
Oh, yes.
All of your carriers actually have apps. Delta Dental has an app. Blue Cross Blue Shield has an app. Health Equity has an app. Teladoc has an app. Teladoc. If you don't know about Teladoc and you're on the high deductible health plan, you're going to want to learn about Teladoc
Go visit them.
because
I was told that.
Oh, yeah, we've had teledocs for
Yeah.
years.
Teladoc,
No, I mean representative.
Yeah, I'm
Oh,
here.
But
I'm
talk to
here.
Jenny.
Oh, you're, oh, okay.
Teladoc, you can talk to board certified docs 24/7, 365 days a year. It doesn't cost you anything, so nothing out of your pocket. And they can call prescriptions into the pharmacy a lot of times. They're not going to call in.
Standard prescription.
Yeah, they're not going to call in narcotics or psychiatric drugs or medical marijuana or lifestyle drugs, but they'll call in your antibiotics and ear drops and eye drops and things like that. And then you pay for your prescription however you pay for it now, but it saves you that office visit, keeps you out of the ER, or we don't have an urgent care anymore, so it keeps you out of the ER if it's a weekend or holiday. It's free for you. You can cover everybody in your household on it, regardless if they're covered by the college or not. So we have magnets and flyers on it over there.
Information on knowledge base on Teladoc also. Okay?
Yes,
Yeah.
sir.
This is a special kind of question, but I'm already on the HSA. One of the settings on my account is to automatically pay eligibility claims or eligible claims.
Mhm.
The default is no. Do you know anything about that?
Basically what it would do is they would then send a notice to Health Equity because they're integrated. If you check yes, they're going to send a notice to Health Equity, and Health Equity then is just going to send a check to the provider, and you're not going to have to worry about it. If you check no, then you're going to get a bill in the mail. I would always check no just because I'm a control freak and I want to look at it first before they send any of my money somewhere. But it's up to you.
It's kind of a pain to either have to, because it's a debit card, there I am going, okay, how do I get back into that facility to pay that invoice that I got? But on the other hand, I'm just like, Jenny, I want to see that bill. I want to know what Blue Cross Blue Shield has said.
Because, and this isn't, it's not a knock on anybody. It's just 95% of the claims that come into Blue Cross Blue Shield are electronic, so nobody actually touches them. So if it's incorrect and nobody sees it, and they just take money out of your HSA to pay it when it was something that shouldn't have been paid, then you have to go through the hassle of getting that money back. And it's not as easy to get money back from providers.
Second question.
Yes.
Last summer I got put out, by an anesthesiologist. And they sent me a bill and we paid it. And we just got a check.
From Blue Cross?
Yeah, kind of.
They're out of network.
For us.
It's free. If you've already paid him, it's for you. Blue Cross Blue Shield, if it's an out-of-network provider, Blue Cross Blue Shield does not send them payments directly. They send them to the member, and then it's your responsibility to pay that provider. So if you already paid him, then that check is yours. If you haven't paid your provider yet, then the responsible thing to do would be to pay your provider. But they can't force you to do that. So
It's got the anesthesiologist's name on it. And it's got my name on it. I assume it's for them.
yeah, anesthesiologists in general don't contract. Yeah, just all you have to do is take it back to if it has his name on it, just go back to the provider and they'll sign it for you, deposit it, still yours. Anesthesiologists, as a rule, typically don't contract because they know they don't need to. And a lot of times you're out before you ever see them, so you don't even know who.
It's not like you can negotiate that.
Emergency room physicians are the same way. Emergency room physicians don't contract very often if that is their primary source of income, because again, they're going to wheel you into the emergency room. You're going to walk in and you're not going to have a choice. Blue Cross Blue Shield is working towards more of a no voice, no choice way of processing those and process them as a network, but it hasn't completely happened yet. But anesthesiologists and emergency room docs, by and by, don't contract. We'll see it with ambulance companies sometimes too. And ambulance companies a lot of times, because if you have to be taken by ambulance, they're usually not asking you who your insurance is. So you usually get that bill from the ambulance company and it never went to Blue Cross. You just have to call Blue Cross customer service and tell them you got the bill and send it to them and they'll pay it. So.
Do you guys recommend the ambulance?
The air ambulance thing?
Yeah, helicopter.
I always recommend the helicopter thing. LifeNet is here to explain why they did away with their membership program and have gone to an advocacy program. PHI, part of the reason LifeNet did it is because they did contract with Blue Cross Blue Shield last year, so essentially they have to take that contracted rate regardless. With PHI, they are not contracted to my knowledge at this point. So even though Blue Cross is going to pay them something, they could still balance bill you. So I just think for the $35 a year, it's just worth the peace of mind of knowing that if I have to be flown out, I don't have to worry about a bill. But it's, you don't have to do anything. You can.
You don't get a choice, do you, when you're laying on the pavement?
Well, if you're in an accident, on the road, or it's something where they have to fly out and get you from a site, they're going to send the closest available helicopter, and that's what you want. If you
can decline and you didn't want.
Yeah, you can say no.
Are you awake to do that?
But if you're in the emergency room and it is not a literal life or death, because we know people get flown out of here for crazy things all the time. If it is not a life or death, you can absolutely tell them, no, I have a membership with PHI and that's who I want to fly me. And if they are available, they'll send PHI. And if they need to, they can send the aircraft from Sierra Vista or Sholo if the one here is gone.
So with the plan that we have, HDHP, you're saying LifeNet was contracted to Blue Cross. Did you cover that? So if we got flown out by LifeNet, would we still be responsible for bill?
Here's how that would work. If you get flown out by LifeNet, you have a high deductible health plan. Blue Cross Blue Shield is going to process the claim. They're going to send LifeNet a check because your deductible is only $3,500, and that air ambulance flight is probably contracted for 45 or 50 grand. So they're going to send a check, and as long as LifeNet receives a check, you're never going to see a bill. So even though Blue Cross Blue Shield said you're responsible for your deductible, LifeNet's never going to ask you for that deductible. Does that make sense?
And then PHI is kind of the same thing. If you've taken their annual program, the minute you're flown out on a PHI thing, they'll bill Blue Cross Blue Shield, and whatever they get from Blue Cross Blue Shield is good, and they're not going to bill you.
But if you don't have
If you
the
don't,
buy-in
then
thing,
you're going to be responsible.
You could be responsible.
You could be responsible for your deductible.
So does that come out as a payroll deduction every payday, or how does that?
It's a
You said
one-time
$35?
deduction. It's going to be a one-time deduction, $35 for the year.
Or you can pay them right now.
Or you can pay them right
And
now.
that's out of payroll, or we're responsible for that?
Yeah, you're responsible for it, but you can either have it deducted from payroll, one-time deduction, and then it'll be processed that way, or you can give her a check or credit card today, and she'll just take the payment today. So she's set up to do that over there. Yes.
Yes,
And she does have
over in the atrium.
she did bring a little square thing, so if you want to use a debit card, she can actually run it right then.
Her name is Mila Palmer.
So is that tax free if we do it instead of payroll?
No. It's in supplemental and optional.
So where are all the rest of them?
Over in the student services building in the atrium area with the
So-
fantastic view of Mount Graham.
Yep. And they're really kind of bored, so, you know, they appreciate the company.
We'll change
Okay.
that.
Don't forget to enter the raffle. There's some really cool prizes.
Okay, thanks, Payson Campus. We're gonna sign off now.